Back to Body Beautiful. We are chatting right now with Dr. Joseph Mele about plastic surgery, specifically liposuction and tummy tucks. A little later, we'll be discussing plastic surgery after weight loss or bariatric surgery. And we'll be taking your calls with any questions you might have about that type of surgery. Here's your phone number, 800-440-4884. We'll also be posting the number for Dr. Mele's office at the end of this segment. Remember, any advice you hear on this show or any other show, you're going to certainly want to consult your own physician as well for another opinion. Doc, you brought some before and after pictures before we take the calls. Let's go ahead and roll some of those. Okay. And because that really shows so much. Okay, what are we looking at?
So this is someone who had liposuction. She's in really good shape. You can see the muscles even before the surgery. Sure. And afterwards, she just had these little pockets of fat down low.
Six-pack ab, the total flat washboard tummy, is that what they call that?
That's what they call it.
So, and no scars? I'm not seeing
There are small scars down in the sort of the groin area down low.
Okay,
I used
on the bikini line?
Yeah, about a 1/4 3/8 of an inch long. So very small.
Okay, so that's, you know, and one would say, well, that's not so bad over there, but I guess this just, did she try working out?
Not bad. She was in great shape. She had very high standards for herself, and I was able to get her there. So
well,
makes it fun.
Okay, that looks pretty good. And the next person?
Now, this is someone who had good shape above the belly button, but below the belly button had some laxity, some looseness, not only of the fat, but there's a little bit extra fat, but also some looseness of the skin, looseness of the abdominal wall, the muscles. So this was corrected with a mini tummy tuck, which has an incision similar to a tummy tuck, slightly smaller, but allows me to access everything below the belly button. And there's no scar around the belly button with this particular one.
May I ask, I mean, is this person that had a child, or is this just a...
it can be from childbirth, could be just from normal weight loss. Okay. Yeah, both can cause it.
Okay, and we should probably, let's go to the next picture. Oh, wow,
so
there's a big difference.
little more involved. This is someone with full tummy tuck. Now, she has a lot of extra skin, some laxity, both of the skin and of the abdominal musculature. I think this is actually someone we did surgery for massive weight loss, because you can see she had a surgical scar running up and down the middle, above and below the belly button. And what I was able to do is incorporate that scar into a tummy tuck, into what we call a fleur-de-lis tummy tuck. It has a resection out of the middle that runs up and down, as well as the bottom. And that allows me to tighten things sideways as well as up and down.
Now, that's pretty profound.
That's sort of the biggest tummy tuck we do.
Okay. All right, let's go ahead and take some of the calls. We have Angela from San Francisco. Good morning, Angela.
Hello.
Hi, do you have a question for Dr. Mele?
Yes.
Go right ahead, you're on the air.
Okay. My question is that I had a tummy tuck already, and I'm African American, and I keloid, and I was wondering, is there anything I can do about getting ready to keloid?
The keloiding occurs about 1% of the time, and a true keloid, not only does it make the scar raise, but it'll actually grow outside the area of the scar. It can be a problem. If I have a patient who's had problems with their ear piercings, and they have large keloids there or large scars there, something I always worry about ahead of time. The goal, of course, is always to minimize that scar, and there are some things that can be done while the scar is healing, even before surgery, to try and minimize that. If you have a keloid, it depends on how long it's been since you've had a tummy tuck. Usually we'll wait a year, let things calm down, unless it's really disruptive. Sometimes it means going back and cutting it out again and closing it, but trying to manipulate the skin, the tissue around there, so that it'll heal more nicely the next time around.
Okay, Angela, so any of the creams and the anti-scarring,
they all help to a certain extent. Just massaging a scar will help.
Okay.
So even if you're using just a regular moisturizer, not designed for scars, massaging it and that pressure on the scar will help to remodel the scar.
And can I ask, what's the difference between a keloid scar and then just someone who tends to scar a little heavily?
We define a keloid scar as a scar that's growing outside the area of injury. A hypertrophic scar is the other type of scar which stays confined to the area that's injured but becomes more boisterous than we want it to be. It's either raised or discolored. At a molecular level, they're different too. When we look at them under the microscope, even the cell response is a little bit different. There's a little bit different mediation in terms of how the body's healing in those, which may be a clue some point in the future as to how to make it not happen.
Okay, so if someone is anticipating that they're going to go in for this kind of surgery, how can they gauge whether they, or you gauge, whether they might have a predisposition?
Well, it's certainly important if you've had bad scars in the past to let your surgeon know and let them look at those scars and decide what type of scar it is. But there are some times when we're going to get a keloid scar, and even if you go back and try and revise it, we still get a keloid scar. It can be very frustrating.
Okay. All right, Doc, well, we've got to go to a break here real quickly, but we'll be back. We're going to be taking some more of these phone calls. For more information about Dr. Mele, you can call him 925-943-6353 or check him out on the web at drmele.com. When we come back on Body Beautiful, we'll have more information talking about tummy tucks and liposuction with Dr. Joseph Mele.